الرحيم. Critical thinking under supervision of Professor Dr. وفاء جميل and Professor Dr. حنان سليمان, prepared by أماني صابر سعد and إيمان محمد. Objectives. General objectives. At the end of the lecture, every student will be able to solve the problems which arise in clinical through critical thinking. Specific objectives. At the end of the lecture, every student will be able to define critical thinking, identify purpose of critical thinking, identify characteristics of critical thinkers, understand the importance of critical thinking, understand critical thinking errors, identify critical thinking and nursing process, identify levels of critical thinking in nursing, apply critical thinking in nursing, explain barriers of critical thinking. Outlines. Introduction, definition of critical thinking, purpose of critical thinking, importance of critical thinking, models of critical thinking, critical thinking error, characteristic of critical thinkers, critical thinking and nursing process, level of critical thinking in nursing, application of critical thinking in nursing, barriers of critical thinking. Introduction. Critical thinking is an important component of most professions. It is the ability to analyze the way you think and present evidence for your ideas, rather than simply accepting your personal reasoning as sufficient proof. You can gain numerous benefits from mastering critical thinking skills, such as a better control of your own learning and empathy for other points of view. Critical thinking is not a matter of accumulating information. A person with a good memory and who knows a lot of facts is not necessarily good at critical thinking. A critical thinker is able to deduce consequences from what he knows, and he knows how to make use of information to solve problems and to seek relevant sources of information to inform himself. Definition of critical thinking. Critical thinking is an intellectually disciplined process of actively and skillfully conceptualizing, applying, analyzing, synthesizing, or evaluating information gathered from or generated by observation, experience, reflection, reasoning, or communication as a guide to belief and action. Purpose of critical thinking. Critical thinking is the general term given to a wide range of cognitive and intellectual skills needed to effectively identify, analyze, and evaluate arguments, discover and overcome personal prejudices and bias, formulate reason in support of conclusion, make reasonable, intelligent decisions about what to believe and what to do. Critical thinking is a domain general thinking skill. Critical thinking skills are not restricted to a particular subject area. Being able to think well and solve a problem systematically is an asset for any career. Critical thinking enhances language and presentation skills. Thinking clearly and systematically can improve the way we express our ideas. Critical thinking also improves comprehension abilities. Critical thinking is very important in the new knowledge economy. The new economy places increasing demands on flexible intellectual skills and the ability to analyze information and to integrate diverse sources of knowledge in solving problems. Good critical thinking promotes such thinking skills and is very important in the fast-changing workplace. Critical thinking promotes creativity. To come up with a creative solution to a problem involves not just having new ideas. It must also be the case that the new ideas being generated are useful and relevant to the task at hand. Critical thinking plays a critical role in evaluating new ideas, selecting the best ones, and modifying them if necessary. Critical thinking is crucial for self-reflection. Critical thinking provides the tools for the process of self-evaluation. Learning critical thinking skills can also enhance your academic performance. Characteristics of critical thinkers: have a passion for clarity, precision, accuracy, relevance, consistency, logicalness, completeness, and fairness. Are sensitive to ways in which critical thinking can be skewed by egocentrism, wishful thinking, bias, and ignorance. Are intellectually honest with themselves, acknowledging their limitation and lack of knowledge. Listen open-mindedly to opposing points of view, welcoming criticism of beliefs and assumptions. Base their views on fact and evidence rather than one's self-interest. Think independently and are not afraid to disagree with the group opinion. Love truth and are curious about wide range of issues. Have the intellectual honesty to pursue insights or truth despite obstacles or difficulties. Are able to get to the heart of an issue or problem without being distracted by details. Critical thinking in nursing practice. Nurses must use critical thinking skills in all practice settings: acute care, ambulatory care, extended care, and the home and community. Regardless of the setting, each patient's situation is viewed as a unique and dynamic. Withholding judgment and being open to options and explanations from one patient to another in similar circumstances. Steps of critical thinking. First step are knowledge. For every problem, clear vision puts us on the right path to solve it. This step identifies the argument or the problem that need to be solved. Questions should be asked to acquire a deep understanding about the problem. The questions in this stage should be open-ended to allow the chance to discuss and explore main reasons. At this stage, two main questions need to be addressed: what is the problem and why do we need to solve it? Second step, comprehension. Once the problem is identified, the next step is to understand the situation and the facts aligned with it. The data is collected about the problem using any of the research methods that can be adopted depending on the problem, the type of the data available, and the deadline required to solve it. Step 3, application. This step continues the previous one to complete the understanding of different facts and resources required to solve the problem by building a linkage between information and resources. Step 4, analysis. Once the information is collected and the linkages are built between it, the situation is analyzed in order to identify the strong points, the weak points, and the challenges faced while solving the problem. The priorities are set for the main causes and determine how they can be addressed in the solution. Step 5, synthesis. In this stage, once the problem is fully analyzed and all the related information is considered, a decision should be formed about how to solve the problem and the initial routes to follow to take this decision into action. If there are a number of solutions, they should be evaluated and prioritized in order to find the most advantageous solution. Step 6, evaluation. The final step is to build an evaluation about the problem that can be put into action. The result of critical thinking should be transferred into action steps. If the decision involves a specific project or team, a plan of action could be implemented to ensure that the solution is adopted and executed as planned. Levels of critical thinking in nursing. The basic level. The first level of critical thinking as beginning nursing student. Trust that experts have the right answers for every problem. Thinking is concrete and based on a set of rules or principles. At this level, answers to complex problems are seen to be either right or wrong. The complex level being to separate own thinking process from those of authorities and analyze and examine choices more independently. Begin to realize that there can be several solutions to a complex problem. Weigh benefits versus risk for each potential solution before making a final decision. The commitment level anticipates the need to make choices without assistance from other professionals. Assume accountability for your decisions. Choose an action or belief on the basis of the alternative solution available. Critical thinking errors. Illogical process. Using a circular argument. For example, a nurse might write the nursing diagnosis ineffective coping related to poor coping skills as evidenced by inability to cope. This doesn't define the problem, it simply makes a circle. Appeal to tradition. This is the argument that we have always done it this way. No strategies and creative approaches are ignored. Bias can interfere with patient care. For example, if we believe patients with alcoholism are manipulative, when the patient complains of anxiety, we ignore their complaint and miss the signs of delirium tremens. Closed-mindedness. The closed-minded individual ignore alternative points of view. Input from important sources such as experts, patients, and significant others is ignored. This results in limited point options and the decreased use of innovative ideas. Application of critical thinking on one selected clinical problem combined with nursing process. Organize the process based on knowledge contain subjective and objective data. Exploring requires inferences, hypothesis analysis, synthesis, and problem solving. Analyzing involves prioritizing decision making and setting goals for care outcome. Use of nursing intervention and skills. Family and other staff involved include medical intervention. Prioritizing and deciding involve analyzing results, reassessing, revising goal and projected outcome, evaluating. Situation: Mr. X has 40 years old admitted to the intensive care unit after vehicle accident. He was complaining of headache, confusion, flushed skin, tachycardia. Also, he had severe pain, unable to move, unable to breathe. The doctor allowed to be admitted in ICU. Neurosurgery and urinary catheter should be inserted. Wound dressing should be made. You are Mr. X. Nurse. Design nursing care plan using critical thinking and integrate the nursing process. Application of critical thinking. Stage 1 Exploring assessment phase. In this stage, organized process based on knowledge contains subjective and objective data. It involves the collection and verification of data. Some data are subjective. These data are provided by the patient usually in response to questions about the current illness, past medical history, family history, and other assessment data are objective, which means data can be verified. These data include vital signs, laboratory test result, physical examination, like regarding to Mr. X. The nurse should collect data related to chief complaint of patient, signs and symptoms of disease, the level of consciousness of patient, take vital signs, take past history or family history from relatives. If the patient is unable to speak, the nurse should determine which type of head injury, skull-base fracture or first degree of injury, major degree of trauma. The nurse makes the necessary investigation as CT and MRI and CBC. Stage 2. Analyzing nursing diagnosis. During this stage, the nurse analyzes the data gathered during assessment and draw conclusion or form hypothesis. The nurse look for relationship and causes between subjective and objective data elements, and by using of skills of critical thinking as inference, hypothesis, analysis, synthesis, and problem solving, we can formulate a specific nursing diagnosis to Mr. X as follows. The common nursing diagnosis for Mr. X according to priority are actual problems, ineffective breathing pattern related to head trauma as manifested by shallow respiration, increased work of breathing, altered comfort related to head trauma, hypothermia related to head trauma as manifested by flushed skin tachycardia, impaired physical mobility related to head trauma as manifested by patient unable to move, reluctant to attempt movement, altered tissue perfusion, cerebral related interruption of cerebral blood flow as manifested by severe headache, mental confusion. Potential problems: high risk for eye injury related to loss of protective reflexes, high risk for infection related to environmental contamination secondary to open wound, high risk for deficient fluid volume related to high temperature, high risk for imbalanced nutrition, less than body requirement related to facial trauma, and restriction of intake. Stage 3. Prioritizing and setting goals. Planning. The nurse makes judgment to prioritize, set goals, and establish desired outcome. Planning also includes developing a strategy for care so that goals and desired outcome may be achieved. Otherwise, she thinks by critical way to set goals of planning for care outcome according to priority. As regard to Mr. X, the common expected outcomes is maintain adequate cerebral perfusion, remain normothermic, be free from pain, discomfort, and infection, attain maximal cognitive, motor, and secondary functions. Stage 4. Prioritizing and deciding. Implementation. Interventions are performed. This may include scheduling diagnostic tests, performing treatment to avoid complication, contacting social service agency to meet psychosocial needs, along with wide variety of other interventions aimed at improving the health status of the patient. The nurse uses skills of critical thinking as prioritizing and deciding to accomplish nursing intervention for patients. According to Mr. X, common nursing intervention related to specific nursing diagnosis are improved tissue perfusion, treat condition of hyperthermia, give medication to treat pain, promote physical mobility, prevent incidence of eye injury, and prevent occurrence of infection. Stage 4. Evaluation. This phase assesses the effectiveness of the plan and the interventions. The next adjust, modify some aspects of the plan and continues those aspects that are working. The next use skills of analyzing results, reassessing, revising goal, and projected outcomes. Barriers to critical thinking, misunderstanding. This can arise due to language or cultural differences, a lack of awareness of the processes involved, or misunderstanding that critical thinking means making negative comments. Reluctance to critique the norm or experts in a field and consider alternative views, feeling out of your comfort zone or fearful of being wrong, lack of detailed knowledge, superficial knowledge as not having read deeply enough around the subject, wanting to know the answers without having to ask questions. Group thinking is yet amongst the harmful barriers to critical thinking, plus it is also quite unhealthy. In such a case, the person doesn't have his own opinion or decision in any given case or situation. To overcome the same, it requires the individual of the group to stand apart and question and formulate their thoughts, opinions, and ideas. The proverb of too many cooks spoil the soup ability apply to these barriers as there is no independent action by the person. Drone mentality barrier can be explained as when a person doesn't pay attention during the important work meeting and discussions and it hails upon any time and on anyone affecting the process of critical thinking, very often daily and mundane routine make a person fall prey to drone mentality. Arrogance is a bad attitude and often hinder with critical thinking abilities. It makes a person with a closed mind and within an opinion that he knows everything and there is no further need for learning new things. Arrogance makes the person fail on a long-term basis as he has closed his channels of learning and is unable to assess the rewards and benefits of critical thinking. Fear often acts as a barrier not only critical thinking but also for the overall growth and development of a person. Fear makes him unconfident, demotivated, and not very able to think out of the box and come up with the ideas and strategies. Fear can arise out of the various reasons such as anxiety, depression, self-esteem issues, and other such personal reasons affecting a person's professional life as well. Stubborn nature. One of the barriers to critical thinking to stubborn nature, as a person with such a nature has his own set of beliefs and ideology, and such barrier is not very welcomed in the world of business, especially the corporate world, as it is ever evolving and dynamic in nature and its approach. The person has to be open to changes and come out from his present beliefs, understanding that the world of business is quite fluid and fast-paced and demands flexibility and adaptability. Thank you.